I'm Dr. Patty Ferris. I'm a board-certified dermatologist, and I'm your host for this episode of Skincare Confidential. For those of you who have been listening, you know that this is a podcast primarily about skincare, and we designed this really to give our listeners a 360 view of the skincare industry. But today I'm super excited because we're actually going to be talking about something that we've never covered on the podcast before. And as I always say, nutraceuticals or supplements are the new cosmetics. So we're going to be talking about cosmeceuticals and nutraceuticals with an expert, Dr. Isabelle Raymond. She's the Senior Vice President of Medical and Clinical Affairs at Nutrafol. If you don't know what Nutrafol is, I don't know how. You might be living under a rock. But it is the number one recommended supplement for patients with thinning hair. And it is really has taken the market by storm and really changed the way we approach patients with hair loss. And we're going to talk about all of that with Isabelle. But let me read her bio for just a second. She's an author and a scientific leader in the wellness industry with in-depth knowledge of functions and interactions within the pharmaceutical, biotech, and beauty and well-being companies. She received her master's and PhD. I knew you were smart. You're something else. In biomedical science from the University of Montreal. She's authored over 70 publications and textbook chapters and books. I'm exhausted, Isabelle. And several therapeutic fields, including aesthetic medicine, dermatology, sleep disorders, and pain management. So you've been around the block, girl. She is super, we're super excited to have her here today because she really is changing the way that we treat patients in dermatology. And I think it's worth saying to begin with that our patients are interested in nutraceuticals. Consumers are interested in alternatives to medications. And I think that this is really sort of the sweet spot where the first Nutrafol products really hit, and that was in hair thinning. So let's talk about this for just a second. Nutrafol really pioneered this category, as you well know. So talk to me about, what's your take on the growth that we're seeing in the cosmetic industry in this nutraceutical marketplace?
Oh, thank you. So thanks for having me, number one. Thanks for including me in this podcast. I've been waiting to be a part of it for a long time.
Yay!
So it's super thrilled to be here and talk about this because, as you read from my background, I come from a different background than wellness and supplements. And so I think there's been an evolution through the years of these products gaining more traction. And I think the reason why is because people are also looking for something different than treatments. They want to maintain health. They want to maintain their skin. They want to maintain their hair. They're looking at optimizing healthy conditions versus treating once conditions start, right? And I think supplements are one of those ways to do that. And with studies behind them, I think also there's been an evolution, and Nutrafol has been on the forefront of this, is really being able to provide science needed to support these because it's not always there. And I think because of regulations and how they're processed through the FDA, it's just a little bit different than cosmetics and drugs. And so not knowing sometimes how they're made or where they're coming from and not having the same labels. We don't have PIs, right? And so really understanding what's behind the products and having that, I think, is also very helpful to gain that trust, to gain that understanding, and also for physicians and dermatologists to be able to buy into Nutrafol. I think that's what happened with them. And really it was a good timing because, as you said, consumers are looking for this, and they just came with the right answers from the get-go.
Absolutely. And I think one thing that was really interesting was how they approached hair thinning and hair loss really with more of a holistic approach, like a whole system approach. So talk about that framework, because I think that was what really changed the dermatologist's mind about using a supplement.
Yes, no, I think it's again approaching any kind of what does your hair mean? And healthy hair is related to your health and not just your genetics. So, think about your environment and what you put yourself through. And so really understanding, really going back into, the founders really did most of this job, in 2015, going out there and really showing the studies of related conditions with hair. So talk about the gut microbiome, talking about stress, talking about all these things on a daily basis that can feed into hair health. And if you take these ingredients to help support that, it will eventually help support healthy hair. And so it's not just waiting for hair thinning and okay, here we have these treatments for it. It's trying to maintain that and really understanding and connecting the dots between health and hair.
100%. Talk about a little bit about the standardized botanicals, because I don't think that's a term that many are probably familiar with.
And I think sometimes they're not always related, right? People assume, botanicals, they'll take them in different forms, and there's not a lot of science behind the amounts in each capsule, right? So I think what we have, over 20 ingredients in each one of our products that are, have vitamins, minerals, botanicals, natural ingredients, and so it's really uh, different ingredients in each capsule. And the standardization comes from ensuring that the amounts that you get, or that, when we do our raw materials, we make sure that we have what we're supposed to be having, and we do quality testing and all of that. That again, people are not always aware of, and are not thinking that supplements have to do these quality testing, but you do, and it's having that standardization maintains and makes sure that you can have the amounts needed or the servings needed each time you take the product, so that it just ensures consistency.
Yeah, there's so much that goes into it. I mentioned a little bit earlier that it is the number one supplement recommended by dermatologists for patients with thinning hair or hair loss. Talk a little bit about the studies, because I think that's really what set Nutrafol apart from all the clutter that's in the marketplace. And God knows there's lots of products out there for consumers to pick from and
There,
dermatologists to recommend.
There are a lot, exactly. And I think it's really understanding what goes behind. So not only do you have to have ingredients that are quality ingredients that are standardized, that go through the process of, safety and all of those things, but then it's like, do these products work? And there's a lot of companies out there who will do, if they do make claims, will make claims on ingredients from the manufacturers, and they don't put the time and effort into doing full clinical studies on the products because that's not required. And so
Right.
investing money in clinical studies, as we know, it's expensive, it's time
Expensive.
consuming. And when it comes to hair studies, it's very difficult because you have to have, the equipment, you have to do hair counts. And so it's exhaustive and expensive. And so the fact that the company has done over, now I think we're at over 14 clinical studies on our products, really is immense. It's what gives me a job, which makes me super happy, keeps me
Yay.
busy. But also
Yeah.
it helps, and it's not just looking at placebo control, really trying to look at, will this product work in different, hair types, different people. And so it's a commitment that they've made to really ensure that the full formulation is studied in the best shape possible. And then we also publish them in peer-reviewed journals, as you know. So we want to make sure
Right.
that we go through that process to have that rigor that you would hope you would see in pharma, but we're not mandated to do that. But the fact that we do it just goes to show that we put ourselves behind our products, and we also invest to find hopefully new potential, new avenues, new things to new conditions to look at. So it's really helpful to be able to have that clinical data to provide that reassurance, I guess, to derms and to HCPs.
Yes, absolutely. I think another interesting thing that the company has done, and where they've really met the consumer right where they need to be, is identifying subgroups. For example, the postmenopausal female, the postpartum female. So, talk a little bit about how do you tweak these formulas? You start with your sort of basic women's and basic men's, and then you really branched out and found, like I said, you met the consumer right at the intersection between the problems they were having and a solution they were looking for.
Yeah, and I think it helps. Thank you. So I think it's really part of like thinking that not everyone's going to go through the same things in life, and understanding the biology of women and men as they go through these changes in life. Your needs are not going to be the same, especially if your hair again is a representation of your health. Your body's going to need certain things at different times, especially for women. And these have all been developed with physicians, which is really great. So we've partnered with dermatologists and OBGYNs to really understand the needs and which ingredients to do best. And I think our menopause, our women's balance, was one of those examples that with derms who were saying, well, they should need more of this because, more saw palmetto. And so instead of just saying you could take the men's version for women who are older going through menopause, they said, let's
Right.
actually formulate something specifically for menopause. So adding that saw palmetto, but also what other ingredients could help mitigate menopause. And so that was a way of approaching it. So every life stage that we look at, we really try to think about all of the root causes, even if they're similar throughout life, like which ones are going to be more taxing during that time and what can we do to best formulate for that time period.
And so I know you added maca to the balance formula for postmenopausal females. How did you tweak for the postpartum female patient?
Well, postpartum was a completely different formula because we wanted to make sure that we could have ingredients that were breastfeeding friendly, and that was a challenge on its
Sure,
own.
I can imagine.
We wanted to make sure we provided something, but because there's not a lot of studies on breastfeeding women, on safety, so we had to, we did a lot of homework. So we worked with experts, we worked with OBs, we worked with nutritionists and herbalists and Ayurvedic practitioners really to get, what has been done, right? So when you think about there's these galactagogues, these herbs, these botanicals that have been used to help with breastfeeding. You're like, okay, well, that's a
Right,
clue that can be helped. Those are ingredients
right,
would be safe. Again, we can't
right.
say they're safe because we haven't
Safe
studied
and
them. They're
helpful.
friendly. They are friendly.
Yeah.
So we used them at servings that were not meant to be galactagogues, but we knew they had effects on the root causes during that
Mm,
time. So, and doing all the safety evaluations. So it was more from a safety standpoint. And really, I think what I love about Nutrafol is that they don't stop. They're not shy about pushing the boundaries to study populations that have been not really studied before, or just, oh well, you got to deal with it. You're going to give, it's expected, so you're going to have a baby, it's expected to lose
yeah.
to have thinning, and why can't you do anything for it? So they're just pushing back and saying, well, why can't we offer something? And I think same for menopause, talking about it number one,
Yes.
and reminding people, hair thinning is part of menopause, let's talk about it and develop something for it. So
Yes.
I love that.
Yes, I love that. I love that too. And postmenopausal females are such a disregarded, you know, population in general. It's there's so many problems that come up postmenopausal, and hair thinning is a huge part of it. So I'm sure that's been a big successful product. And I know the same with postpartum females. I mean, we would normally just say you have telogen effluvium. It takes 3 months, but you know what? A lot of times it doesn't take 3 months. Some people really go into a protracted effluvium, and those people are looking for answers. How do most people use the supplements in their practice? Monotherapy, combination therapy. Do you have sort of an idea of how practitioners use them?
I think, I think it's definitely evolved over time. I think at the beginning there was, like anything, there was skepticism, especially,
For
when
sure.
we didn't have all these studies. And now I just think it's become part of the routine, talking to people like you and other experts, dermatologists, they just, it's important to understand the root causes. And so I think it's a nice way to engage with their patients. And also, my understanding is any kind of hair thinning issue, you throw the kitchen sink at it. And this is a nice first step to really address the root causes. And because we're looking at more of a holistic, integrative approach, it's not localized. And so it should support everything that you are doing beyond that holistic approach. So, any kind
So
of treatments, anything else.
medications, PRP.
Yeah. Yeah. So there's no reason why it would not be part of that armamentarium of treatments.
And like I said, consumers seek them out. They're looking for alternatives because unfortunately, most of the medications we use do have side effects.
And I think a lot of people who have gone through, especially for the men, I think there's a lot more side effects coming, and I'm reading all about them, and I think they're a little bit scared. So thinking that it's that or nothing. So this is just a nice way to provide some kind of support as they go through this journey, and even alongside if they're not seeing any side effects.
Yeah, absolutely. Let's talk about your newest venture. So as you move away from hair thinning and hair loss into skin, and how did you sort of mirror the framework that you use so successfully for hair with the skin supplement, which again is such a great idea? And I'm sure you're going to do all the right things in terms of studies. We'll talk about that. But how did you all use that same framework?
Well, first, I mean, I'm so excited. This is one of the products most excited about for many reasons. Because when I first joined Nutrafol, which is my 4-year anniversary today,
Oh,
um,
wow. Really?
so I've been there a long
I was
time
thinking
now.
about that when I was reading your bio. I'm like, how long has she been with Nutrafol?
Just before the
Okay.
pandemic, 2 weeks before, it was kind of crazy. And what a journey it's
Must have.
been going through all of that. And when I
Yeah.
first started, I was like, why don't we do something for skin? And some of the founders, Roland, as you know him well, he had said,
So
we have a
well.
lot of people who are a lot of derms who are seeing these anecdotal evidence of skin improving, and they want to do IIT, like an investigator-initiated trial on just to see how the skin improves. And so we were hearing, and then, but of course, with the pandemic and other things, we just kind of didn't have the bandwidth. And then
So
the
these were
more,
patients taking hair
yes, we're
that
taking
the,
the hair that they were, and that the dermatologist was noticing and improvements
right.
in their skin. And again, this is very anecdotally. This wasn't
Of
studied,
course.
but
Of
some
course.
of our questionnaire studies we did ask that, and so it kind of made sense. And then other team members joined, and they kept pushing the company like, you really need to start looking at this. But because it's such a hair focused company, it's like, how do we we
How
should
do
be
we do
focusing on
it?
hair. But then when you think
Hmm.
about, well, we're focusing on the root causes, and if hair is a reflection of your health, and so is your skin, right? And so
Right.
looking at these overlapping mechanisms and just doing now 2.5 years of research and putting this idea together, and really, if we were going to do it, we had to do it well. And so we had to convince the executives to really let us go in
Yeah.
that direction. And so started with like really looking at the studies. So really what they did for hair, we looked at skin the same way, and then looking at the ingredients, and we formulated, and then we had ad boards, and we met with you guys, and what do you
Yes.
think? And so it's been a work in progress. But I think it's really we're really thrilled, to be able to share all the basic mechanisms behind these root causes. And it's going to be a little more of a challenge for skin, I think, because for hair, there was very few solutions for hair thinning. When for acne, there's a lot. It's a crowded
Right.
market, and so we really have to have an approach of like how we're different, and how the root causes that we're going to target are different. And so it's not really a competition with other products or other or drugs or topicals. It really is a different way of approaching acne in general. So that's our first challenge
Absolutely.
of publishing the data and supporting that, and talking to dermatologists and asking them we invite them to look at acne, approach acne in a different way.
Yeah, and when you're changing a paradigm, Isabel, it's hard because doctors have, it was kind of like when we started with hair. We were used to looking at the microenvironment and the testosterone and the, well, inflammation around the follicle. And then we started expanding and thinking more holistically about the whole body. The same thing with acne. And I think those publications are going to really speak to the science behind the formulation, but talk a little bit about the formulation and some of the sort of interesting botanicals that will be incorporated into it,
Yes.
or I
So
should say have been incorporated into
yes,
that,
yes, have been. Yes. So we are, we
as I
are.
have it sitting on my desk.
So yeah, God, we're
I
so
love the blue, by the way.
the
Hair
blue
is
is.
green, for those who don't know. I love the blue.
Yes, it's a brand new color. It's just such a different. It's bringing
Cool.
a new life into the company, I ever think, because it's bringing us back to our roots. Pun intended, about really trying to approach a condition in a different way, and that's going to take convincing. And I think our first two publications that are coming out or have already come out in JDD are really going to support that. So I encourage people
Yes.
to really read that, because that is just supporting a paradigm shift to look at acne in a different way.
Right.
Again, a
Right.
complementary way. We're not saying don't look at acne the way you have before, but just
No.
be open to potentially other ways that could contribute to acne. And so again, this is all non-cystic acne because we're supplements. So we're targeting mild to moderate with these ingredients. And again, it's, doing that fun research of what is out there in terms of ingredients. Now that we know the root causes, now that we've
Right.
identified those, then it's what ingredients do we have to support either those root causes or patients with acne with those ingredients. And so doing that full research, that lit review of, because there's a lot of botanicals, they don't have a lot of studies in them, so
Oh,
it was a
yes.
it was a big
It's a
job to
challenge.
it's a
Yes.
challenge to find, to show the safety and efficacy of these. And so there are some great studies out there, with zinc. You have your typical ingredients that are part of the AED guidelines that they mention, but they've always been these single ingredients. And so it's really hard
Single
to
ingredient
single
studies.
ingredient studies to
Yeah.
show, comparison or in combination with. And so that's a decent approach. But, we're challenging, like we're going to put a lot of these ingredients, like in the Nutrafol way, over 20, vitamins, minerals, these botanicals that are specific for these root causes. And we're talking about metabolism. We're talking about gut
Gut
microbiome, skin
microbiome.
microbiome. So
Right.
really, and by combining all of them, the theory would be that by combining them, you would see a synergistic effect or something beyond just one ingredient. And very happy to share that even by studying the formulation
Right.
wholly, then we do see some pretty great results. And so more to come on that. But
Hmm.
yeah, so these ingredients are anything from konjac root to berberine, and they're very interesting, and we're happy to share all of those details in those publications.
Yeah. So it's so interesting. I think dermatologists are more open to this now, especially as we've begun to look at the gut brain skin connection. And now we're talking more about nutrition and we're talking about avoidance of foods that can flare acne. So I think derms are, again, really looking for these more holistic approaches because we know that all these things are important. Acne doesn't exist just in the pilosebaceous unit. I mean, there's inflammation in the body that can occur when you get gut dysbiosis. We know that that's a factor. We know that obviously the skin microbiome is affected with certain strains of Cutibacterium acne. So I think it's just all so fascinating. And then, watching you all kind of piece together all these pieces of the puzzle to give the, I guess we say the consumers this option for something that they could use either in combination with traditional therapies or also use as monotherapy if they're reticent to take medications. I mean, we have a lot of side effects with a lot of what we take, and we can't discount antibiotic resistance, which is a huge problem that we, unfortunately, as dermatologists
Yes.
contribute to because we love to throw that doxycycline around and the minocyclines. But, they work so well. And then, of course, you have isotretinoin, where some patients can't take for whatever reason, which again is a fantastic medication, but not without certain side effect profile. And then
Yes.
even things like the anti-androgens, which are great for female patients with acne, but once you want to get pregnant and things like that, you have to get off those. So we have so many compounding factors and so many, I guess, twists and turns in the patient's journey that makes us have to keep switching therapies.
Yeah, exactly. And I think this again, the way we are inviting dermatologists to look at this is really hopefully helping with ingredients that or root causes that were not touched by medication or by topicals, right? And stress is one of those
Right.
examples, right? Stress, like
Oh,
what do you do for stress? We say, you cam, you do yoga, you meditate, all those things. But
right.
there are some great ingredients out there like ashwagandha or holy basil in this case that have been shown to decrease cortisol. And so really thinking about the patient, the consumer in a holistic way. Now, we can help with your stress because there's no medication for that. And so the gut microbiome is making sure it's healthy, and providing those probiotic and prebiotics to be able to support that. We know, and also if you're taking antibiotics. And so it's
Absolutely.
kind of supporting. So it's really looking at the whole patient, and thinking about other ways that can contribute to acne that we can hopefully provide a solution for.
The female adult acne patient is really a unique subset. And I think that the whole overplay of stress and how that plays into the adult female acne, I mean, it's real and it's a problem. And, we can't quit our jobs. That's what we can't
No,
get rid of our kids. Those are the two big stressors. I won't
oh,
say
you bet.
husbands or boyfriends because that would be number three, but we're going to leave that
No,
alone for right now. But I mean,
no.
females carry so much responsibility and female patients always complain about, I'm under so much stress and I don't sleep enough. And we recommend the things that you said, trying meditation, stress relieving activities like exercise and things, but doing something like an adaptogen, which is something that could maybe just give you a little bit of a lower serum cortisol level, which there's some really good studies on
Yeah.
ashwagandha, I know, and holy basil. So I think those are wonderful things for female patients to consider.
And also, I think, from the research that my marketing colleagues have taught me too, is that, adult female patients do not want to take the same things they were taking as teenagers. If it's
Right.
persistent acne, they're like, I'm not going to go back on like it. So it's almost not an evolution, but something maybe more tailored. And our acne supplement is uh, developed specifically for adult women
Adult.
acne.
Yeah.
The root causes are the same with men and women, but we really tailored with specific ingredients for that population, knowing, with the stress and hormones. So we want to make sure that we had the best, and knowing that, adult female acne is something that you see a lot in your office.
Do we ever? There's a subset of patients who didn't have acne as teens who develop it as adults, which I'm sure is stress induced and the whole package of root
Needs.
causes that we talk about. They get them all. And then you've got the patients who have it as teens who continue to have it. So those persistent acne patients, both of whom are really difficult to treat. Like I said, a lot of them are in their childbearing years. A lot of them are breastfeeding. And, it's a hard group to treat. So this will be really a nice addition to our therapeutic armamentarium. How do you envision the clinicians will position this? This is really going to be a I would say a big paradigm change
A
for
bit, yes.
practicing dermatologists.
Well, I think that the advantage that I have at Nutrafol now is I have the legacy that has started, right? So we are not just
Right,
launching a new idea. We I think we're tried and true when it comes to how we approached hair, and we want to make sure that the community understands that we're approaching skin in the same way, and that we did the same
right,
research. And the benefit now is that we are actually launching with 2 clinical studies behind us and a third on the way. So that was never done before. So we're thrilled to be able to have some data behind the product to begin with, as a formulation, not just as ingredient claims or saying, try this. So we have
right.
photos, we have a great insights, and we're also working with people like you to really help us understand the best studies and who would be these patients and what other products they would be on, right? Because we know that acne is not, it's not just, tell someone stop your skincare regimen for a study.
Yeah,
It's no, they're not going to stop that. So
no,
what fits in, and so we have these different conditions or these different selection criteria to make sure that we know where the product fits, and we'll get more insights. And I think from the derm community, we're hoping to really get better insights into who they use it for and with what and the results they get, and also the expectation. So far, the results that we've gotten from case studies that we've done is kind of all over the place, really, for patients who are tired. They've tried everything, they don't know what to do anymore, and it seems that they're okay with trying a supplement. So more to
and then
come
I'm
on
sure,
that.
yes, and I'm sure there's plenty that are using it in combination with topical medications and retinoids. I mean,
Absolutely.
everybody's using retinoids. So I'm sure it can be done both. And in the studies, you're actually, at least one of them, you are using it in combination with treatments, allowing the patients to stay on their regimens.
So for the first study that we did, it was we had to do a full washout of everything. We just allowed them to
Right,
stay on their topical regimen that excluded
right.
any type of medication, because we had to show, does this work, right? Or who
Sure.
would it work for? So that was
Absolutely.
we got great results. This Our second study
Absolutely.
was in combination with whatever topical regimen you were on. No orals, but if you are on a topical regimen, including salicylic acid or retinoids, and you still have these blemishes, still have this mild to moderate acne, you can enter the study. And so that was added on top of their topical regimen. And then we're now on doing a placebo-controlled trial, which will be a little bit different. But we're throwing everything at this because we really believe that the ingredients are fantastic. The formula, we've worked on this formula for 2 years. So, and we're very proud. And so we are no problems, investing money into these clinical research studies.
Yes. Well, I think it's what sets the company apart. And as you know, I've been a fan of this brand for such a long time. I think so many of us now are open to using, complementary and alternative medical treatments, using CAM along with our medical therapies. And patients appreciate that. If you tell them, this is something that's been tested, this is something we can use in combination. And I think consumers and patients are looking for that kind of advice. So kudos to Nutrafol once again for hitting the nail on the head, doing the studies, and now part of my job, and certainly your job, is getting the word out there. So we are super excited to have this data. This is, to me, every bit as exciting as hair was. I think skin is going to be really, really huge. So
I agree.
Congrats on this. Congrats on the launch. And I think the rest will be history.
Thank you very much. And thanks for allowing us to be able to speak about this with you today.
Oh, I'm so glad you came. Thanks so much, Isabelle. For everybody out there, keep your eye on this. This is a really exciting new addition to our treatment armamentarium and a new way that we can approach patients with skin problems, much the same way that we approach those with hair thinning. So thanks so much, Isabelle. Everybody have a great day, and thanks for listening.
Thank you so much.